Today, we want to acknowledge the survivors of the Sandy Hook school shooting at the end of their civil case and those impacted by Parkland mass shooting as their sentencing hearing comes to a close. We also want to welcome you to the 4th National Town Hall sponsored by the NMVVRC. Nearly 300 participants have registered for today, to include victim survivor services. Apologize. Nearly 300 participants have registered for today's town hall, representing 38 states and 6 countries besides the United States. Top 3 professions for today's participants include victim survivor services, emergency management, and mental and health and behavioral health. And today's fun fact, nearly 6 out of 10 participants have experienced an NBI in their community. And over half have responded to an NBI in a professional capacity. So there's great expertise, not only in our presenters today, but also in our audience. Thank you for participating. Some housekeeping announcements that we will have today. This National Town Hall will be recorded with the recording, slide deck, and resources featured in the chat function available on our website, nmvvrc.org. And thank you to many of you who sent questions for our presenters in advance. We will save some time at the end of this seminar to answer as many questions as possible. Identified are our learning objectives for today, as posted on the slide that you can see on the screen. Our National Hall presenters include Eugenia Pedley, our Senior Program Manager, Maggie Feinstein, Program Director from 1027 Healing Partnership, Tennille Pereira from Las Vegas, Jesse Arias from Orlando, and our own Alyssa Reingold. Ann Seymour is unable to join us today. I will now introduce you to Eugenia Pedley. She is the Senior Program Manager for the Mass Violence and Terrorism at the Office for Victims of Crime, OVC, within the U.S. Department of Justice. Since joining OVC in June 2012, Eugenia has worked with communities and organizations across the country that request Anti-Terrorism and Emergency Assistance Program, EAEP, funding to support victims of these incidents. She led the development of the OVC's Helping Victims of Mass Violence and Terrorism Planning, Response, Recovery, and Resource Toolkit. Everyone, welcome Eugenia.
Thank you, Claudia, and good afternoon once again to everyone. I'm so glad you can join us today. This webinar really builds on the previous town halls. Excuse me a second. My computer seems to have frozen here, so please bear with me. This webinar really builds on the 3 previous town halls. We talked about the importance of planning, appropriate resources, and an effective response. While all those activities consider victims' perspectives, resilience and recovery is really only about victims. We know that mass violence events rock survivors and the broader community. And in an instant, lives have changed forever and things will never really be the same. So the question then becomes, how can we help victims be resilient and adapt to their new normal. To some degree, every mass violence event has a different effect on each survivor, and every incident has its own unique features. There are also ripple effects throughout the community that go beyond the actual victims. And all of these aspects need to be considered when determining the best approaches to helping survivors and their families. One of the things you will learn about today is resiliency centers. And I'm pleased that so many of OVC's AEAP mass violence grants have funding for them. In general, these centers can provide a single point of entry for victims to access 360-degree wraparound behavioral and mental health, medical, legal, financial, and other services. Many of them provide on-site services and also help connect victims with appropriate community services. In some centers, there's also room for activities that cannot be funded under OVC, but are still adjunctive programs that may be appropriate for some of the victims. And because resiliency centers can be both comprehensive and flexible, they are often a valuable tool to help survivors. So with that, I invite you to sit back and listen to these great speakers.
Great. Thank you, Eugenia. Well, welcome everybody. As Claudia mentioned, I'm Alyssa Reingold. I'm from the National Mass Violence Victimization Resource Center. I direct our Preparedness, Response, and Recovery Division. And I'm going to start us off a little bit today by talking just in general about what resilience and recovery, what those terms mean. Talk a little bit about some information we've been gathering from some communities that have experienced mass violence and understanding kind of the larger impact on communities. Talk a little bit about components that can go into fostering resiliency and recovery, and then we'll be handing it off to some of our other experts here that'll talk about how they've been implementing that in their communities. So to start off, I just wanted to highlight that there are a number of different definitions out there that to define resiliency and recovery. And resilience is really the process of adapting in the face of adversity and stress. From my perspective, resilience does not necessarily mean the absence of difficulty or distress. It is about the process of sort of managing change in one's life while carrying the challenges of trauma and stress and grief along with them. And recovery is really the restoration of safety and empowerment. Now, some things to consider when thinking about how to foster resiliency and recovery in your communities that have been impacted by mass violence. It's really important to recognize that there's no one size that fits all, that communities are unique, individuals are unique. And grief and trauma responses, there are things that we do know that we can potentially predict for some folks, but it's also unique for each individual and their experiences. And that context of each event is important and each community is important. So some things to kind of bear in mind. Just want to highlight a little bit, this is a community phases after disaster that SAMHSA has put out. This is defining disaster, thinking about communities at large. Mass violence is different, clearly, from a disaster, but I do want to highlight some areas of potential similarity and some areas of differences. Again, this is thinking about communities at large, not necessarily individuals, but large, community that's been impacted by mass violence. One difference, a big difference from a disaster, is that in a disaster, there's usually some type of pre-disaster warning, ability for some folks to prepare, perhaps, right? And in mass violence, that doesn't always occur. And often there is no warning on a community-based level, and there's no ability to prepare. You have an impact, often that you see in a community after an event. You'll sometimes see sort of the community coming together to support itself, to support each other, unifying, it's a wonderful supportive aspect. And we can see some community, for some communities, again, not all, some community cohesion initially in the early stages as folks are coming together and supporting one another. Then we tend to see over time, sometimes some disillusionment where emotions tend to drop, that trauma cues can impact the community at different times, whether that's other mass violence incidents, whether that's information about the incident at hand. And there can be ongoing cueing events that can exacerbate community response. We also see response emotions can drop in communities around the 1-year memorial time period. And then we can see, hopefully over time, some sort of reconstruction, new beginnings as communities try to make sense and try to figure out how to put pieces back together and working through their grief after a mass violence incident. And there's some literature in the trauma field looking at individuals, that sort of community response, and leaning on the trauma field, looking at individual resilience trajectories following a potentially traumatic event. We see different trajectories among individuals. We see some folks that have coined here in this model as resilience that tend to be able to manage that distress early on and continue to manage it. We see some folks that perhaps have a delayed response. Maybe early on can manage that distress, but over time their distress gets worse. We have some folks in our recovery, coined recovery arm, that early on there's significant distress, and over time they're able to figure out how to recover. And then we have some folks that really struggle early on and then continue to struggle throughout. So it's important to recognize that not everybody responds the same way, that many people do recover, many people are resilient, but we need to make sure we're tailoring services and tailoring our outreach to be able to accommodate all the different potential trajectories. So the Mass Violence Center has recently been doing a little bit of research in this area and evaluation. This is just some initial pilot findings from our current studies. We're in the process of getting a little bit more in the weeds of analyzing this data in a little bit more complex manner. But we've basically sampled over 2,000 adults in 3 different mass violence impacted communities, that of El Paso, Parkland, and Pittsburgh. And what we found is that compared to the national PTSD averages, which is around 4.7%, El Paso, the community at large, so not just victims, but the community at large, were 5 times higher rates of PTSD than the national average. Parkland, 4 times higher. In Pittsburgh, 5 times higher. So kind of really paying attention and recognizing that mass violence not only impacts direct victims and those family members, but it can impact communities at large. We also are learning from some of the information that those, and this is kind of a little bit of a busy slide, but that social support plays a very critical role in how one adapts to mass violence. Not something new from the trauma literature. We kind of know that from our trauma and victimization literature, but it holds true for mass violence. Those with high levels of social support is protective. So what was we thinking about as community response need to do to improve our social support for those? But we also know that those with prior victimization, prior sexual assault or physical assault, actually were increased risk of PTSD and difficulty. And then the combination of those low social support and prior victimization were at even greater risk. So thinking about identifying those potential at-risk individuals that within your community that you could be outreaching and making sure you're attending to. So just want to highlight just a couple of components that foster resiliency and recovery for you to consider after a mass violence incident. We're going to hear from some of our other speakers today and how they've been adapting and implementing these types of strategies, but considering a needs assessment, both individual needs of those impacted and community-based needs. As I mentioned, every community and individuals are unique, and so making sure you're doing a good, thorough needs assessment of what areas of strength your community has has, as well as what area of needs and gaps that need to be filled. We know that earlier evidence-informed early interventions can be potentially helpful shortly after, including psychological first aid, skills for psychological recovery. We know, I just mentioned, support and connection is really important. Education about trauma response and about how to manage trauma cues can be helpful. So we can validate these very natural responses that occur after, an unnatural event. Well-being strategies may be helpful to kind of round out your resiliency approaches. Victim advocacy navigation is super important, and community outreach and engagement is essential because folks aren't often going to come to you. You need to figure out how to engage your community members, especially your marginalized groups and populations in your community, making sure you're interacting and establishing relationships sooner rather than later. Helping with remembrance and memorial events, evidence-based trauma grief treatments, and then making sure your part of your wraparound services is helping your helpers. So addressing compassion fatigue and vicarious trauma of your responders. So at this point, I'm going to hand it over to Tennille and Jesse, both from the Vegas Strong Resiliency Center and Orlando United Resiliency Services, to be able to talk a little bit about their perspective on resiliency centers.
Thank you, Alyssa. Good afternoon. My name is Tennille Pereira. I'm the director of the Vegas Strong Resiliency Center. And
Hello,
Jesse, go ahead.
Hello, everyone. My name is Jesse Arias, and I am the director for the OURS, which is the Orlando United Resiliency Services.
Next slide. So it's really important to note that resiliency centers are not one size fits all. There's, two really big factors that come into play here, and that is going to be the incident as well as the community. So the type of incident is really going to impact what the needs are and how you're going to kind of fashion your resiliency center. So you're going to look at the victimized population, the size of the population and the impacted community, the location, the method. So, how you respond to a shooting, may be different than how you respond to a stabbing because the needs of the individuals could be different. And then the response, so that immediate response that the community had will also impact how a resiliency center gets structured. And then the community specific, I can't stress this one enough. Every community is so different. The resources that are currently available, the different victim services, as well as, the types of hospitals, if you have a rural community versus a very urban community, it's going to look different. The dynamics within the community and how the organizations work together, available funding sources, money is always going to be a factor when you look at how to structure these services, as well as your local government. All of these are going to impact, who owns the project, who is part of that project, and what is available to provide in regards to the needs, which is really usually incident specific. So, but some general best practices really have been emerging, and some of those is you really want to invite your key stakeholders or community problem solvers to the table. Here in Las Vegas, what happened was our first responders set up a family assistance center, and they looked out in the community and they said, okay, here are kind of our community stakeholders or problem solvers, and here are the needs that we have. And they started making phone calls and saying, I think your organization could provide hotel rooms for the families. And I think your organization could provide legal services, or your organization could come in and help with the lost identification card. So all these different pieces, and they pulled us all to the table, and we all kind of problem solved for any pieces that were missing or how we could kind of make this work. moving forward once that Family Assistance Center closed, and we had to transition to a Resiliency Center. And then very important, identifying the resources and the underrepresented or vulnerable populations. So we had a couple vulnerable populations here in Las Vegas. One was we had a large Spanish-speaking population that was providing services at the venue, and a number of them were not documented. And so we had to make sure that we built into our Resiliency Center the ability to reach them and provide the services that they would need, because some of the community resources would not be available to them. So just some of those things to kind of think about. And you always want to keep the entire impacted community in mind, because with general victimization, not mass violence victimization, you really are looking at a small nucleus of impact, which is generally the family and close friends of the individual that's victimized. But when you're looking at a mass violence incident, your entire community is going to feel some level of trauma based on that incident. So you always want to make sure you keep that entire impacted community in mind. Next slide. So these are some pictures of the Vegas Strong Resiliency Center. We were established to address the long-term recovery needs of those impacted by 1 October. And essentially, I provide these pictures just to show how, every detail of our center has taken the impacted community and the resources in mind, even, down to our sensory or yoga room. So next slide. We are a multi-agency collaborative structure. So this is what works best for our community. We are managed and operated by Legal Aid Center of Southern Nevada. The legal aid was part of the Family Assistance Center and one of those problem solvers that was at the table when we were establishing what the Resiliency Center would look like. And part of the physical location, we have people here from Clark County. So we have a social worker who is now ingrained into our emergency management operations, as well as our social services. We have someone from our police force from Las Vegas Metro Police Department, a victim advocate, so that we're connected to that side. And then we're also connected to our state organization that provides a number of behavioral health professionals to help us with the programming on that side. And we also do work with our Victims of Crime program right here in our offices. They are here also. And then we have a number of other mental health providers throughout our community that provide direct services at their location. And we work with them, we consult with them, but they don't provide actual direct services here at our location. Next slide. So our goals are really community resilience and victim assistance. And so we work to foster healing and community resilience. Through a number of different ways. So outreach has been really, really important in our Resiliency Center. There were 22,000 ticket holders at the Route 91 Harvest Festival when the incident happened, and they are from all over the world. So we have had to work very hard at our outreach. We do media, we do direct mass mailings, emailings. We do a lot of social media. We've really worked hard to connect with them however we can and wherever they are. But our outreach isn't just to the individuals that were here at the concert, but also our community as a whole. And we also use outreach to raise awareness for the issues that impact our survivors and our bereaved families, but also raise awareness with our general impacted community on some of those things that Alyssa was talking about. So on our psychoeducation piece, you know, letting people know, hey, here are some things to expect around this time. So every year on the annual remembrance events and occasions, you know, we'll do some outreach and we'll do some press to make sure that people understand what they can expect and also what they can expect in their loved ones if they were directly impacted. And so we do a lot of outreach. It's such an important piece. I remember when I first started this work, one of the things that I was told was, don't ever think that because people aren't calling your phone or walking through your door that they don't need help. And I have found this to be so incredibly true. We do a lot of one-on-one individual outreach to our survivors and our bereaved families. And that is generally where we discover the needs that are there, discover that they really are in a place where they need some assistance. So super important to do outreach. And then some of our services and resources are navigation and case management. People, when they're dealing with trauma, you know, this is probably going to be the hardest time of their life. And we don't want to leave them out there floundering on their own to navigate what can often be a very daunting system of victim services. And so meeting them where they are and doing that alongside of them, we find is very helpful. And then we also find some, you know, get to a point where they are empowered by doing some of that on their own. And so we just are kind of there to support them along that way. Mental and behavioral health services are very important. Our greatest request is for mental and behavioral health. And what we do here at our Resiliency Center is we do behavioral health navigation. So we work with them one-on-one. We look at what are your resources? What do you have available to you? And then we go within their community, because again, we have people all over the world, and we find a resource or provider that fits that need. And then if, you know, that doesn't work out for them, then we will look for another one. And then judicial process support. So we had a number of lawsuits that came up. We didn't get involved in any of the lawsuits that were suing the hotel or going after anyone, but we were there to at least answer questions and kind of let them know how that could impact things. So they had, you know, attorneys at their fingertips that could really give them honest and truthful information, because there's always a lot of misinformation out there, as we know with social media. You know, bad information can get out there and it can just kind of run the gambit. So always helpful. And then legal services. So we provided them a breadth of civil legal services. So foreclosure, eviction, debt collection, a whole number of things we've helped them with, and we've been able to provide those free of service. And then emotional support. Sometimes they just need a place to call and say, hey, this is how I'm feeling today. And I don't need anything. I just wanted to know that someone's on the other end of this phone and can talk me, you know, just talk to me for a minute. So just being there sometimes is the biggest thing that you can do. Next slide. Programming and events, as well as education. So we call them outreach sessions. So we'll do a little, you know, information session on different types of therapy, or we'll do a quick little meditation or try yoga to, you know, kind of break down barriers to getting services, break down barriers to different mental health services. And then responder wellness. So this is really your first responder, but as well as your long-term responders. Some of those mental health providers that have been doing this services for years, your own staff at the Resiliency Center. So making sure that their wellness is always taken care of as well. And then remembrance services. So you'll have the different memorial services that happen right after the incident, and you're there to kind of just provide support or direction or guidance. Maybe work with your coroner's office to provide information and be that contact. Different memorial sites will get set up, and then you'll have, you know, sometimes permanent memorials that will be built, kind of being the voice of the impacted community with that. And then your annual remembrance. So every year, when that time of year starts to come around, you'll see that, you know, the feelings can come back up. There's a lot of emotions and different things that come with that time of the year. So you want to provide additional support, but you're always going to want to make sure that you provide some type of annual remembrance, or at least support the survivors and families in the way that they want to remember that day. And that is always a very, very busy time of year here for us, but it's a time of year that we're really able to connect with the impacted community, really look and analyze where are we? What are the outstanding needs that we haven't met? What are the little pockets within our impacted community that we haven't been able to reach quite as well? And then we kind of design programming around that to meet those needs and reach those people. So it gives it a great opportunity to connect and also raise awareness in our community. And then advocacy. So we've provided a lot of advocacy throughout our community, different community partners. So for example, sometimes language will be used by, you know, maybe it's our police force, or maybe it's, you know, another community leader. They will use some terminology or some language that, you know, really impacts our survivors or families in a negative way, and they will generally let us know that. They're, you know, generally very verbal, and then we can work with those community figures and say, hey, this, you know, is the way that they really like that referred to, or could you use this language? It really is more trauma informed. And generally, you know, those figures are very grateful for that information. So we've really been able to educate our community on that and make our system more trauma informed. So one of the things too, I wanted to kind of touch on a little bit here today is, you know, when you have a regular victimization where it's just one person that kind of impacts that family or those close friends, you know, there's not always a lot of coverage on that. And while it's sad, it's not likely to really change your system. Mass violence is, you know, so horrific that it impacts the entire community. And, you know, it does bring about, you know, I hate to call it an opportunity because that's a positive term, but it does bring about an opportunity to look at your community and look at the way that your victim services are and the way things are structured and say, can we use this to change things, you know, to move things forward in our victim services, you know, overall. And, you know, I do feel that while, you know, regular victimization really doesn't move that needle much, if at all, when you have a mass incident like this, it gives, you know, that's really that opportunity to kind of dig in there and look at ways that you can change the system for better and moving forward. And so we really have worked hard to do that here in Las Vegas and in Nevada. And then, you know, looking at if this were to happen again, are we in a better place today than we were when this event happened? And that really takes us, you know, to kind of our sustainability. And I'll just touch base a little bit on what our sustainability has looked like and what the planning is for that. So then I can turn it over to Jesse because he's also going to talk about that piece. But here we've been able to, and give me 1 second. I just want to make sure that I'm not taking his time. Here we've been able to, from the beginning, design our Resiliency Center so that we have sustainability built in. So we've really worked to integrate with our emergency management team here locally, as well as the state. So we are ingrained in it and we work with them on their plans. So any planning for a response, they have us at the table to say, here is, because they'll do things sometimes and they're not trauma informed and they're really not victim centered. And so we're able to be at the table to inform that. But we're also now providing services on another kind of branch through different funding to all victims of violent crime. So we're providing services to all victims of violent crime that kind of mirror what we've learned and what we've done here, so that we will be an ongoing entity in case this does come up again. And, there's a lot of different pieces that go into that as far as funding and different community partners and things like that. But I'll leave it there so that I give Jesse plenty of time to cover his. All right, go ahead, Jesse.
Thank you, Tennille. I know Tennille and I have spoken a lot over the last couple of months, and it's, there are a lot of parallels between what the Resiliency Center in Vegas has gone through and what ours and our resiliency program here in Orlando have gone through. And it's always very interesting to kind of compare and contrast as we, as time moves forward. And it really does come down to a lot of, revisiting and looking back and saying, and, what worked and what didn't work, and really viewing those opportunities for growth. So as we were creating this, or as we were putting this together, there were definitely a lot of parallels and there were some unique things. And so I'm really going to touch on some of the, for us, at least for the Pulse community and the Orlando community as a whole, some of the things that we've learned. And I think some of the things that throughout the years have been the common theme when serving our community and when serving our survivors. And so I really want to be able to put that into perspective. And so, Pulse tragedy happened on June 12th, 2016. We lost 49 angels. And after that, when the OUAC, we are called today the OURS, but about in 2016, several months after the tragedy happened, our program was actually called OUAC, and we've since rebranded since June, officially July of this year. So when we really talk about like what are some of the needs that we've seen throughout the years, what our Pulse community has really asked for, I would like to preface that by the importance of trauma-informed care approach. And the importance to being trauma-informed really lies in always having at the back of our minds, or as our baseline, is that anyone who comes in through our doors has a potential to be re-traumatized by a process or a program or an organization that doesn't take into account someone's story or someone's background or someone's mental health when they walk in through our doors. And so one of the biggest things that we have seen through our community needs with the Pulse community has been mental health. Mental health has been supremely important, even when some survivors weren't even ready for mental health in the very beginning. And just being cognizant and having that, sense of awareness that, they've just experienced a highly traumatic event and they're just not ready for that. They, it's very scary. And so for us, learning to have therapists who are LGBTQ affirming was the start. Having therapists who could understand what someone from the gay community or could empathize with them or could speak to them. So that was always something that we kept in the back of our minds, and really labeling our message of, okay, have you seen a counselor? And maybe perhaps that's something that it seems like a far-fetched idea to some of our survivors at the time. And we've had survivors come forward 6 years after the event, and they have never received services. They always felt that survivor's guilt, right? That this space could belong to someone else, but the conversation was always, no, this is meant for you. And so some of our things that we have done throughout the years. And I think that what we've learned, or at least our opinion is, the importance of having a therapist on site, someone who's very much a part of the team. And I'll talk a little bit about what we did in the beginning, which was the no wrong door policy. And so we had mental health providers that were off-site. And so today, when we look back, we wish we would have had a therapist who is on site 5 days a week, or even 6 days a week, or at least on a weekend, to be there for our survivors, because I think it would have been extremely important. Some of the things that the center today does from those lessons is we do have everyone in the community has 4 free sessions of mental health counseling by therapists who are LGBTQ affirming. Pulse survivors have also received counseling sessions at no cost to them, and the sessions are unlimited. We've also opened up the space for gun survivor groups and trauma and coping, as well as creating LGBTQ safe spaces. Some of the things that we have are things like financial support and advocacy funds, but since the start of the program, those have gone down a little bit, and it's been a struggle to try to help out our survivors with things like housing or just financial support. Immigration has also been a big one. I know Tennille talked about serving the undocumented population, but for us, it's been something that we have also struggled with, and there's a lot of limited resources. Next slide, please. So I'm going to breeze through it. So for us, in the very beginning, the Office of Victims of Crime provided technical assistance in creating to the Orlando community as a whole. So the City of Orlando, Orange County, and Heart of Florida United Way, under the AAP grant, the Anti-Terrorism and Emergency Assistance Program grant, we were able to create OUAC. We served some of our primary impacted groups, which were the survivors and families of the 49. If we ever needed, we would vet. If we needed to vet some of the survivors, we would have a point of contact with the FBI. Under that, later on, we've found out, obviously, that with the LGBT community, the importance of chosen families plays a huge role in understanding that a lot of these biological families or blood, people who are blood related to them aren't always necessarily have been there for some of the survivors. And so sometimes you'll notice that we'll have the importance of chosen families, people who have given them a roof over the head, and there's no relation there whatsoever. So the no wrong door policy in the very beginning was that the idea was that anyone can come through our doors, and as case managers, victim advocates, we would be able to connect them to whatever community resource was out there in the community. So next slide. Some of our ongoing sustainability efforts is, in the very beginning, we had OUAC, we had funding from the AAP grant, Surge grant, and then through Orlando City and Heart of Florida United Way, which we were a part of, and then Orange County and Osceola County. I think one of the lessons here learned is we became a program for the Center of Orlando as of January 2021. And we have now been a part of a much bigger organization. And so our ongoing efforts are sometimes June 12th coincides with Pride Month. And so sometimes those funding efforts coincide with Pride Month as well, because there's a big community togetherness, come together. And it's a bittersweet moment because it's where, Pride happens, but at the same time, it's also a hurtful time with June 12th. So our ongoing, whenever we do get funding, is also taken out from the operational funds that's under the center. So next slide, and I'm trying to be mindful of time. So finally, some of the things that we've learned, or what our philosophy has, we really believe in the establishment of more permanent resiliency centers across the nation. Programs like ours, right? So like ours, or unfortunately something like, the resiliency, the Vegas Strong. And I hate to say that, but there's something that's going on in our country at this present time. And it's very unfortunate to have to wait until something horrific or a tragedy or mass shooting happens before we establish resiliency centers or have programs like these that are trauma informed or trauma recovery centers. And so some of our philosophy is to have those established already and not go through the headache of trying to figure it out to create things from scratch, and you know, have people really deal through a lot more pain and suffering longer than they should have. So we believe that resiliency centers are great. We also have worked with victim services centers as well and domestic violence shelters. However, there is a little bit of a difference for us, simply because sometimes we feel that human trafficking survivors or gun violence survivors, LGBTQ or other hate crime survivors or victims, it's, you know, the question is where do they go if they can't be serviced by victim service centers? So I think that resiliency centers or more permanent ones can fill in those gaps, especially for people that perhaps don't fall in those criteria for those type of service centers. And so that would be our call to action. And I think I'm at time, so thank you.
Great. Now we're going to hear from Maggie Feinstein, who's the director of the 1027 Healing Partnership in Pittsburgh.
Thank you, Alyssa, and thank you to Jesse and Tennille. I am the director, like Alyssa said, of the 1027 Healing Partnership, and 1027 is in reference to October 27th, 2018. And our organization was started about 6 months after the shooting. And you know that part of the questions that I'll be addressing today is a little bit of how we get started and what does the work look like. But generally speaking, our organization is similar to Tennille and Jesse. We serve the direct victims of the event. And then we also serve those who feel the effects of such a violating event and people who've experienced anti-Semitic trauma or traumatic grief. And we help through counseling, being a gathering space, commemorating the same way that for Vegas, they call it remembrance. That's, you know, a term that we often use is commemorating, and we share best practices. In the picture here, you see sort of one of the pieces when we were talking about resiliency centers, and for the people who have not set one up, you know, part of what we often talk about is what Jesse just ended with, this no wrong door concept, the idea that we do want to make sure that there's as many doors open to people after a mass violence incident. And some of those doors may be familiar doors that already existed before the event. Sometimes you need to have extra doors so that people can continue to get services who were not connected before or who are feeling the impact of the event. And then the other sort of key part when we get started is this question of ripple effects. We are told that part of our goal with resiliency is how do we shore up the ground underneath us? And so in this picture, you see some of our staff, and one of the things that we've faced as a ripple effect is just as we were getting started, the pandemic started as well. And so we went from creating a space where people could meet inside to staying as flexible as possible. And this is what we call canopy conversations here. It was a COVID adaptation, but how do we meet the needs of our community and also do that safely? And so, you know, just as an example of what our work looks like, in this canopy conversation, you see one of our trauma therapists that's part of our staff, and then we also have financial literacy support. And that was something that in the pandemic we figured, you know, take it outside, make sure that we are available and accessible. You know, the next slide. One of the big parts that we do in the sort of long-term community resiliency is we talk a lot about what is trauma, right? And that is an important component. That one of the things that that you have to sort of start with is this concept that the community doesn't always know what is trauma, what is communal trauma. And so this is just an example, you know, but one of the work that we do is often going around and educating, sharing best practices, really being able to contribute to our local community's capacity to support people. So, you know, when we do this talk, often I talk about how trauma is a given human condition, especially after a mass violence incident. People will say, oh, it's so sad what happened to those people. And so we always say what happened to all of us, right? That may not be the trauma that impacted me, but that on the other hand, I can relate to people on the component of trauma being a human condition that together we can heal from, and that it is better off when we do that together. But really important is often educating people that incident can be traumatic because it disrupts our sense of self and safety, so that the perception that is individual, respecting that and making sure that our services allow people to define for themselves what's traumatic more so than us defining it for them. We really take into account the primary, secondary, and vicarious trauma. And especially with the mass violence incident, it is so important to understand the differences between the primary trauma experienced by direct victims, the secondary trauma that can be experienced by people who are very close by, and then the vicarious trauma that can be experienced by people who relate to the event and feel as though they could have been there. So we'll go to the next slide. I think it's really important to know that when we're talking about trauma and when we're talking about a community trauma, that trauma is not something that exists in a vacuum. It's not one incident. And, people will say all the time, I'm really feeling awful. I don't know why. I don't think it's about 1027. And I always say, that we don't have to always know exactly what is causing us to feel a certain type of way, but being able to notice it's the most important part. With collective trauma, it's really important that we sort of realize that we exist, again, not in a vacuum. We exist in relationship to a lot of the people around us. So when there's a traumatic event that can shatter sort of the community norms, the experiences of safety, the ways in which we engage with each other, that it's really important to acknowledge it. We do a lot of talking about that in terms of the organizations that existed before and that were first responders in the event, and that how has that response really impacted their organization's group norms. If you think of water cooler conversations, if you think about when people send emails, how they send emails, the urgency when organizations were part of the trauma response means that it is sometimes that what was before a given doesn't become a given anymore. We have sort of shattered that norming, and we are recreating it as we go. And I think that one of the really important parts is that what Alyssa showed us in that early slide about disaster and disaster recovery is that the communal aspect means that people are experiencing the impact and loss at the same time. So if you think about those two slides that Alyssa was showing us at the beginning, that we're experiencing it at the same time, we're experiencing it entirely differently. So same event, different response from the people around us. And one of the things that's really challenging with that is that we, if you look at that image that I have there of the umbrellas, that what happens if somebody starts swinging that umbrella around or just behaving sort of in an unpredictable way with their umbrella, we expect for people to kind of keep it uniform and be aware of where their body is and what's going on for them so that we can kind of move around that. But when there's collective trauma, what sometimes happens is that it's hard to see each other. It's hard to see each other for each other's experience. And so my pain starts to impact somebody else's, and it results in sort of mixed empathy. We're not always showing up for each other in the way as a community that we would like to. And what I wish somebody had told us when we were getting started, as I know that's part of what the topic is today, is I wish people had told us that that's normal. And that that's okay. And that if we can anticipate that there's a lot we can do to also support our community through that. But everything from being in the grocery store around the first anniversary to actually planning the first commemoration and the first anniversary events, it was a time where everyone was so heightened and experiencing their own anniversary effect at the exact same time. And that just contributes to, not being able to be as present for each other as we wish we could be. You can go to the next. So, what the Resiliency Center job, how can we as Resiliency Centers help build capacity for communities to be more resilient? And part of it is acknowledging trauma, understanding the individual factors. Tennille talked about that, right? That there's no situation that's exactly the same for any of us because our communities are different, the victims were different, the intent was different. There are, though, some similarities. And so one of the similarities is that we know that trauma impacted people directly. It took loved ones from families. It also, unfortunately, the people who witnessed and experienced, and then the first responders who responded, that there's a similarity in the fact that is one of the byproducts of these events of mass violence in our communities. And it's easier for us to identify the primary trauma that people have experienced, well, at least in our community. I think, Tennille described 22,000 ticket holders. That is a lot harder. In our community, 3 synagogues, 3 congregations were worshiping in one synagogue, and those 3 congregations were very communal. We knew all the people who would be there, and it was very much easy to identify who the primary trauma victims were. But it's really hard to find the secondary and vicarious trauma victims, and that hate-motivated mass violence incidents really deepen the experience of secondary and vicarious trauma, largely because we know who the people who are attacking us, what their motives are. And so for a lot of the people who identify in that group, it can really feel like the trauma was so much closer. Our vicarious experience is so much closer. And so, you know, what do we do about that? It's one of the big challenges in starting a resiliency center and doing that effectively. We're challenged to provide that psychoeducation regarding trauma to the people we can identify, those organizations that responded or the people we know, but really also to as one of our community members said, you got to shout from the rooftops. Shout from the rooftops that it's okay to not be okay. Shout from the rooftops that we are all going to heal better together. And shout from the rooftops that there's another door that people can walk through if they don't have one that's already working for them. So, you know, that is really what we've tried to do. We do that in using media. And that's, I know, a question that somebody had for us to cover today, but I'll jump into it really quickly here, just that we want to make sure that we use our newspaper outlets, our television outlets, with creative ways of using op-eds, earned media, advertising in local papers that shares that message. It's okay to not be okay. We are here, and that people heal together. We use social media in that way. Social media works better for the people who are already following us. It's not really, you know, a great way to find new people, but it is a good way to reach people who look for our organization. And then we find opportunities to get in front of diverse people that could have been impacted. And I think all of us have touched on this. Alyssa mentioned it, and I know Tennille and Jesse did too, but that we can't wait for people to call us or come in. We have to find creative ways. That might mean, you know, getting into the schools to do a talk on something that's adjacent, but not direct about 1027. It may mean, you know, showing up at synagogue events and being able to participate in them openly and being sort of there to engage with them. But we have to find opportunities to spread the word that we exist, to spread the word that it's okay to not be okay, and to do that as effectively as we can, as early as we can. I'll keep going. One of that communal trauma, you know, impacts is that we have to notice that the community has different sort of stages of adapting to it. And so back to Alyssa's slide where we saw, you know, some people will, you know, be okay, and then hit a period where everything gets really hard and they have to go through their grief, or they have to, you know, work on their coping skills. Some people do that early, some people never do it. It's a little bit of all over the map. But what happens is that what we've learned, and what I've heard from other resiliency centers, is you have a lot of people who say, oh, do we have to keep talking about this? Can't we just move forward? I don't want to keep talking about this. Can't we go back to who we were before? And that creates a little bit of a tension that I think can be okay as long as people know it's natural. And part of it is because in the short term, we have to sort of stay in our crisis response, right? That's sort of physical posturing almost for responding to that crisis. But then in the long term, we can't operate like that because it doesn't give people a sense of safety or security. And so we really want with communal trauma to acknowledge that tension is normal, that different grief reactions are okay. And that sometimes when people say, you know, how's your community doing? That's always a hard question that I get a lot of the time. And when the how's your community doing question means that we actually sometimes have to help educate people that our community is not sort of one feeling, and that there's diverse feelings, and that they're all totally healthy and normal, and not right or wrong. And that when there's trauma cues from new mass violence incidents, that those ripple effects really can bring those grief reactions back. Different incidents, you know, one of the things I've learned, unfortunately, over this last year, as we've seen so many more people joining our community, is that different incidents impact different people. And so when there's another shooting, some people in our community are really, really shaken by one incident, some by others. And so we respond sort of individually with that to the community. My last sort of piece that I just want to cover, because unfortunately we are now, we're not the only mass violence incident that was from a hate motivated crime. Like Jesse mentioned earlier, that Office of Victims of Crime really provide us a ton of support, needs assessment, and we have benefited from the Anti-Terrorism Emergency Assistance Program grant, the AEAP grant that some other resiliency centers have benefited from, which is wonderful because it gave us a lot more flexibility in how we are responding to the community. But the grant also attaches a definition by who was victimized. And so back to what I was saying a little bit before, that hate motivated events increase the secondary and vicarious trauma survivors, that one of the challenges, and for anybody who's joining or who's planning for their communities, acknowledging that with hate motivated crimes, it is really important to supplement the AEAP funding, because one of the things that early on, you want to make sure you're attending to the direct victims. You want to really make sure that you've done whatever is needed to give them the resources they need and to build some sort of relationship there, and to be able to acknowledge those who on the broader spectrum have been impacted by the vicarious and secondary trauma of the event. And that's not really supported in the AEAP funding, but it can be something that if you early on supplement, that you can make sure your communications can match that, you can make sure that your programming can match that. And knowing that that is also something that is just a challenge. And, the picture that sort of goes with this is sometimes people feel like they are on the outside looking in, and that we try our best to manage that, but it can be a big challenge. So I think that's all I have for right now. And I know I was trying to keep up with my time.
Great. Thank you, Maggie. Appreciate it. So I'm going to talk just really briefly before we go into some Q&A with our panelists here. I want to talk a little bit about some lessons learned that we've been hearing from our Resiliency Center directors and administrative forums that we have been working with. So beginning in 2017, the National Mass Violence Center has been providing some consultation to resiliency centers. Initially, we're starting one-on-one consultation. In the past several years, we facilitated and started up a Resiliency Center Directors Forum, as well as a Resiliency Center Administrators Forum, both to kind of provide opportunities to exchange ideas, problem solve, talk about how we can improve services and long-term sustainability. Unfortunately, now in our country, we have too many resiliency centers that exist now that we have enough to be able to formalize this forum together, as well as to kind of address a little bit of what Maggie said, what I wish I had known when I was just starting out. And so we've been meeting for a number of months, supporting each other. And then from those forums and meetings, we've begun to develop a promising practices for mass violence resiliency centers based on a lot of the work from our directors and our program managers and our resiliency centers and administrators. So this is kind of their work. So I'm going to just highlight a couple points that kind of capitalize a little bit on what Jesse, Maggie, and Tennille have already kind of talked about. But coming out of this forum, some factors for success have come around collaboration and partnership, structure of the Resiliency Center, potential funding ideas for future funding, making sure you're providing comprehensive victim services, and community and public awareness strategies. As it relates to community collaboration and partnership, definitely need to build on pre-existing relationships. So as Jesse mentioned, when a mass violence incident occurs, right now there isn't in most places, there isn't an actually existing resiliency center. And so how do you build something that didn't exist to start with? And so kind of you got to start with what relationships you already have, identify what strengths your community has, identify key players who have certain specialty skills to help. Perhaps elicit support from leaders at the federal, state, and local levels. Identify what your gaps are as you're collaborating, and then engage the community in collaborative decision making in trying to figure out how to build your resiliency center. And then as you're going along, you're going to develop some very specific job descriptions for each individual. As far as the structure of Resiliency Center, there are some guidelines or some more information on the OVC toolkit, mass violence toolkit online for you as well. But I just want to hit a couple things that have come up through our forums. So sharing the AAP grant with the Resiliency Center leadership is really important. So often, as Maggie alluded to, there is a grant that gets written. And then often when a Resiliency Center is then established, resiliency director is hired at that point. And so that individual wasn't necessarily part of the planning phases in developing that grant. And so making sure that all relevant partners are aware of kind of what the scope of work that indicated and how one should build your resiliency center. I think there was a question that I was asked that how long does it take to get a resiliency center started up? And it really depends on the community. Sometimes they start usually around 6 months afterwards, but sometimes to have a brick and mortar building, that might take time to find a location, to identify your natural landing spot, if you will, and that sometimes can take up to a year. You don't want to necessarily, you want to be able to provide resources. That doesn't mean that you don't hold off on providing resources in your community, but to really establish a center, you need to take time to really be mindful of who's going to be steering that center, how is it going to be set up, where is it going to reside and live, and you want to make sure you select a sponsoring agency that has a history of fundraising to administer that grant, as well as to be able to administer other funds and to have the organizational structure to be able to guide that where that center may live. Center directors, as I mentioned, usually get hired on, and they can have very different backgrounds and have different skill sets, which is great. So there's not one size fits all. And so you want to build on those variety of experiences. It could be a mental health background, victim service background, legal background, nonprofit background in general. You want to also make sure you want to be thinking about sustainability from the beginning, because AAP funding is limited. It is fantastic to get things off the ground and be able to provide really essential resources, but it doesn't go on forever. And so thinking about what are the needs of your population that might be 4, 5, 6 years down the road, as Jesse kind of mentioned, that some folks didn't walk in the door until 6 years down the road. So in order to do that, thinking about sustainability, you need a clear mission and vision and strategic plan, perhaps even connecting to grant writers earlier. Develop your long-range plan, whether that's going to remain within that specific victim population or whether you're going to expand it after the initial grant ends. So just some food for thought for people to think about. As I mentioned, you got to think about other resources of funding, not only in kind of your AAP grant, but, are there other creative ways either in your state or in your community that you can access other types of ways to fund specific aspects? County Housing Authority, state VOCA funding, other state sources, county tours and taxes are just examples of ways that some resiliency centers have been creative. And you want to also be mindful and thinking about lessons learned from victim services. You need to make sure you're leaning on what are the long-term needs of your survivors in your community. That this is based on maybe whatever program evaluation research you're doing and gathering some survivors' lived experience to kind of help with that. You want to identify and document everything from the very early on. That's going to help you with future funding, and it's going to help you figure out your gaps and challenges. You want to identify whether your center is going to be a behavioral mental health agency or victim service agency or hybrid that kind of incorporates both disciplines. And so there is not one size fits all. It could exist within an existing victim service center, or maybe it's not. Maybe it's something that lives under a different type of umbrella. Also, just want to highlight, we do offer some, the role of a victim service navigator is essential. It's somebody that kind of really connects people to the resources and knows the resources in your community. We do have a position description on our website for that type of individual, what all the different potential job duties that individual may be doing. And then we want to talk about, as Maggie mentioned, engaging public relations, figuring out ways to be proactive, engaging the media in different ways, both to get psychoeducation out and information about the resources that you have. So having a strong social media presence, maybe engaging a public relations firm as sort of pro bono to help out. So kind of determining a messaging strategy is really important. So I want to highlight a couple other resources that are available. We have a number of different resources on our website. There are a number of different tip sheets that are geared for victims and survivors and victim service professionals and mental health professionals and community leaders. If we're not here to reinvent the wheel, we also have a number of tip sheets on our website that other folks in the field have put together. If you see other good information out there, let us know. If you see something that's not there, let us know. Follow us on Facebook and Twitter, and we have a wonderful podcast series. And then also just want to highlight that we have developed a self-help app for community members and victims and survivors after mass violence called Transcend NMVC. It's a free self-help app that provides some resiliency strategies. Before we jump into our Q&A, I just want to highlight a couple upcoming relevant conferences. So there is the Leave No Victim Behind conference that is occurring in San Marcos in about 2 weeks. There is also the International Society for Traumatic Stress Studies in November, which provides a lot of the latest research in the trauma field. And then the Association for Behavioral and Cognitive Therapies this year is highlighting the main focus is on emergency and disaster preparedness response. And so that's specifically for our mental health providers that may be here today. You can request some consultation from the National Mass Violence Center by just sending us an email. We will do the best we can to assist you or direct you to other folks that can. So before we kind of go to our wrap up, we've got about 10 minutes or so. I do have a couple questions that came in from our attendees during the registration, and we sort of coalesced some questions here. So I'm going to invite Maggie, Jesse, and Tennille back on with us so that I can ask y'all a couple of questions if you don't mind. All right. Great. So I'm going to actually probably put this out to each one of you. What would you say are effective strategies for communicating with survivor families versus the general community?
I'll go first. So we have worked to establish relationships with family members in the bereaved family community that I would kind of call ambassadors. They've kind of rose to the top and taken on a leadership position within the family groups. And so we work with them to kind of gauge how they are doing, as a group, but also kind of propose ideas or different things to see, what they think, bounce off ideas. And then we also use them to communicate because they really walled themselves off. The media coverage right after the incident was crazy. And so they kind of pulled away and formed like social media groups and different community groups like that. And so we do it that way. We also do it one-on-one, and then we do emails with them. So also our navigators have personal relationships they've established with a number of the families. And so that's how we communicate with them. Whereas the general population, there's a lot more kind of mass emails, mass social media.
Yeah. I'll jump in and sort of echo what Tennille said. We have a little bit of a different communication strategy because naturally our population was just different, but similarly for the direct victims that we try to make sure there's one-on-one communication. We've tried many different things, and it is a big challenge. Early on the question, you can use the tools that exist for communicating things out, such as Slack or other messaging apps. But that depends on your demographic. For ours, it does not work at all. And people, there's the big part of this question is that communication matters totally, and that it's almost impossible to get it right until you've gotten it wrong, is sort of the piece I would say. So mostly I use direct emails to the families and survivors, and then we use great newsletter. And to echo what Jesse said earlier about wishing that on day one, they had put the resources into having an in-house clinician. On day one, I wish we had put the resources into having better communications internally. We have an incredible communications firm, but having the capacity to manage a good newsletter, your social media, do all those things are really important because people are looking, and the earlier you can do that well, the better you can put them at ease with that.
Yeah, so I know for us, we've tried different things, different routes like mass email communications, posting it on social media. I know for the Latinx or predominantly Latino, Latina, or Hispanic culture, word of mouth plays a big role to probably getting a friend or someone that they're close to and saying, hey, can you talk to such and such person? And sometimes I think it's that trust or that they might have versus reading an ad somewhere online. And so just getting someone that they're comfortable with and saying, hey, would you mind coming in with them? So kind of like a buddy system. And that's been effective. And, But besides that, yeah, just publishing, mass communications, text messaging, WhatsApp has been a big one for us, especially for people who, you know, are coming from a different country, or that's been a huge one. So just along those lines.
Thank you. And this one I'm going to ask Maggie, what do you recommend in fostering resilience for victim service providers following a mass violence incident? And kind of related, as a care provider, how do you take care of yourself?
Yeah, it's a really important question, because I think probably anybody who asked that, maybe people who are unfortunately joining us that are newer in this field, that it's really hard because the work demands flexibility. It's not really easy work for boundary setting. And so, you know, oftentimes we recommend boundary setting for self-care. I think that it is really important to be able to acknowledge and name that vicarious trauma exists for all of us. It's not just for the people we serve, it's also within the offices and the people around us. I think that really making room for people to create their own plans for what they might need, you know, again, the boundary setting piece, it's different for each individual within teams. We've also partnered, we've had a really nice partnership that we started early on with a sort of a workplace meditation and mindfulness group called Awaken, locally here in Pittsburgh. But they have done trainings on how to bring mindfulness and mindful practices into a workplace. And so we did that not just with us, but with our other Jewish serving organizations that were sort of first responders, and tried really hard in that first year to care for the caregivers. We said we found that a lot of the folks who were part of our community who responded were really impacted by the trauma of that. And so using tools like Awaken were to spread the culture in workplace for how to take care of yourself and how to name and acknowledge what might be going on for you.
Thank you. And also, for reference, OVC does have a vicarious trauma toolkit that also could be a good resource for organizations to kind of better help infuse addressing the needs of vicarious trauma within at an organization level. So I know that's kind of a resource. Anything, Maggie, that you personally have done to take care of yourself?
Yes. You know, I really try, and I think of always boundary setting is it should be based in your values. And so, you know, I'm a parent with young kids, and there's lots of times where I can't do other things, but getting them off to school in the morning, I try to not schedule things. I try to make sure that's my time. That's an important thing, you know, that I've done. And I don't think everyone does the same thing, but for me, that is the time of day that I've kind of carved out as sacred and only to be taken if there is something else that has to happen. And I think everyone needs to define that for themselves. The only other thing really quickly, and I'll make sure Claudia has the citation, but we did have a really wonderful research study conducted of the agencies that responded as first responders. So a lot of our Jewish serving organizations about the traumatic impact on staff. And we use that OVC vicarious trauma toolkit, which, so when Alyssa said that, it reminded me. And the data really indicated that a lot of professional staff at organizations that weren't designed to be trauma responders had vicarious trauma at the same rates as other first responding agencies, police, fire, EMS, dispatchers. And there's good reason to believe that that is true in lots of organizations. And so we've talked to the researchers about how important it is to do the research versus how important it is to respond early for those organizations, as though vicarious trauma is going to greatly impact their workforce, and that using some of that toolkit is beneficial.
Yeah, thank you. Jessie, I'm going to ask this next one of you. How do you tailor services so that they are culturally competent for different populations in your community? I know you kind of touched upon that in your presentation. I don't know if there's anything you wanted to add to that.
Yeah, of course. So even though people tend to think of the gay community as this just one big, it's, you know, it really is, it's a big community, but it's very diverse. And even though at Pulse there was, you know, you'll see it in the news that it was predominantly Latinx night or Latin night, but even that in itself is highly diverse when you think about all the other people that weren't considered. You have the Black community, you have you know, you had people who weren't just from the States, they were from other parts of the world. And so It was a really diverse, you throw in gender, you throw in sexual orientation. So you had people from all walks of life. I would definitely think about intersectionality and how it plays a role. It really played a role, especially for our staff, being able to recognize our places of privilege whenever we sit down with our clients, being able to understand that you might have never undergone through a citizenship process, but then when someone who's across from you has been promised that they're going to get their immigration papers or their citizenship, understanding what that process means. The truth is, it doesn't happen overnight. It could be 5-6 years later and they still haven't gotten any of that paperwork finalized. And so for us, intersectionality played a big role, making sure that our team was pretty diverse. It was predominantly Hispanic and Latinx when we first started, but really taking into account, race, gender, sexual orientation, really knowing our audience, really knowing the people that we are serving and making sure that they feel represented, right? That the person across from them can speak to them and with language that they're going to understand. So I would say intersectionality, understanding that, and being culturally competent and having a diverse team.
Thank you. And Tennille, I'm going to ask this one of you. What more can be done to support mass violence survivors relevant to traditional news media and social media? So any tips that you may offer to survivors if they face questions on social media or just managing the news and media in general?
Yeah, so this is a really big one. And I think it's something that we see communities when they first have an incident of mass violence kind of fall, to some holes with. So immediately it's important for the victims and the families to recognize that they do not have to speak with the media and they should not feel pressured to speak with the media. And I think it can be helpful. So one of the things we did is we had a public information officer kind of assigned to work with the families so that if there are media requests, they have a representative to work with the media to say, please, they're not going to do interviews, or, to arrange that, to review the questions before the interviews, and to be there and provide support if that interviewer crosses the line, to stop the interview and say that is not an approved question, but also, to provide advice to the families. Sometimes we'll see young children that are immediately out there on national news, and I'm always concerned, I'm always worried. I know some of our survivors, they did, because the media was everywhere and we had survivors everywhere, with 22,000 people down there, really was not a controlled situation. And so the media was down there getting interviews. And I have survivors to this day that tell me that they're traumatized every time they see this interview that they did, or they don't like that it's there and it's going to be there forever. So 10 years down the road, when they apply for a job and someone does a Google search, it's going to be there. So, just providing that guidance and information before they do those interviews. And then social media, recognizing that social media has its place, but it's also okay to turn it off. That it can cross a line where it becomes unhealthy. And providing alternative connections so that they do feel like, okay, I can turn this off, I'm still going to be able to connect with other members of this impacted community. So those are some of the big ones that we've tried to use, but we've also put out like resource care, or tip sheet on healthy social media use.
Thank you. And the Mass Violence Center also has some additional tip sheets, as well as managing the media, as well as managing trauma cues that may be going on as it relates to the media. All right, so just for time's sake, each of you, if you just 30 seconds or one word or one sentence, as far as what would be one take-home message that you have for anyone that's just starting in this space of building resilience after mass violence. So I'm going to start with you, Maggie.
Yeah, I think that my word of wisdom would be something that someone from the 9/11 community had said to me, which is that the product will always match the process. And so I think that since, being victim-centered and centering the experiences of those most directly impacted is the work that we're all in, that really we always have to make sure our processes match that if we hope that that's the work that we can do in the end. And it's hard, but it's worth it.
Thank you. Tennille.
My advice is to practice gratitude. This work is not easy. So if you always look for the reasons to be grateful, because I am extremely grateful that I am able to do this work. I'm honored every day to work with those that I work with. And when I focus on that, I can always push forward.
Thank you. And Jessie.
I don't know if I have one specific word, but one big takeaway is to continue to hope that the mission and vision that we have, it's an incredible fight to be a part of. It's hard, it's challenging, but being able to be a compassionate witness for people as they go through this journey can mean a whole world of a difference. And on a personal level, I know it's changed me personally and as a professional. So I would say really learn to listen. And as Maggie earlier said, also, it sounds like learn to adapt because things will change. And any promises made by funders or funding, I would always make sure to follow up on them because sometimes they don't always happen. So
Thank you. And mine is probably similar, is having patience and compassion, I think are really important. Patience and compassion for those around us, and patience and compassion for ourselves, because as folks mentioned, it is tough work. And so making sure we're always trying to practice and extend that compassion. So thank you all. Thank you so much, our presenters here. I just want to highlight our next National Town Hall, which will be in January. The topic will be on hate-motivated mass violence crimes. We'll have kind of our websites here for our different organizations that participated today: OVC, the 1027 Healing Partnership, Vegas Strong, Orlando Center, and the Mass Violence Center. And then we do have a survey if we'd love to get feedback from you all. I know we could probably spend all day talking about resiliency and recovery. And so hopefully we just gave you a couple nuggets for you to take away with, but please complete a survey for us. And it will be in the chat box, and you'll be getting an email request to complete the survey as well. And with that, I thank you again to Eugenia and Jessie and Tennille and Maggie for being here today. Thank you all for participating. And I hope you all have a safe afternoon.
If you've
Thank
joined
you.
us by phone, please make sure you send us an email to nmvvrc@musc.edu so we can capture and send you your certificate of participation.